And we can't have the show start without that music that's become so familiar over the years. And let's get things going. Here's the host of Helping Seniors of Brevard and the executive director as well. As I always like to say, our daily double or BOGO. Here is Kerry Fink. Hi, Kerry.
Hey, John Harper, thank you. And John Harper, if you don't know, is president of the Helping Seniors organization. You know, we were just talking about this. I am fresh from a great event that we were having at the Senior Resource Center this morning. And we were talking about the fact that Joe Steckler, who was the founder of Helping Seniors, he started us off 15 years ago, but that was only after he had already put in a second career of being a very, very successful captain in the U.S. Navy, because he built up the Brevard Alzheimer's Foundation and did that and retired from that. Joe just couldn't stay retired, so he got us rolling. And John Harper has been longtime vice president, helping Joe build this, going back to Brevard Alzheimer's Day. So now he serves as president, and Nancy Deerdorf, who's our operations director, she's also like John, going all the way back into Brevard Alzheimer's Days. And I always joke I'm the new kid on the block because I only got started with it when Joe was getting this thing kicked off. And it's with me to this day. You know, Joe's last words to us were, you guys got to keep this going. This is important, and it is so important because seniors really do need that help. And that was literally, Joe was in a hospice bed, and he wasn't thinking of himself. He was thinking of, we got to keep this thing going, because he goes, people need us. And so I thought we have the wonderful opportunity to sit down with a great friend of Helping Seniors. Her name is Denise Bergman. She is with a company called Senior Care Authority, and you're going to learn about what she does, because she helps families find the right option when it comes to senior living. But we have had this conversation because Denise has also been a friend of Helping Seniors for a long, long time. You know, Denise, it was 3 years ago that we moved into the Senior Resource Center, which is that beautiful space that Dr. DeLegdish and the Omni Healthcare medical team made available for us on the second floor there. And it's hard to imagine, you know, Helping Seniors 15 years. Now we've been at the Resource Center for 3 years. You were one of the founding members who helped us get that whole concept off the ground, because that was the thing that Joe was always after. He said, you know, we said it takes a village, but he said, you got to get all these resources together. And boy, Denise, you have seen that to be the case in the work that you do too.
Yes, absolutely. Good afternoon, everybody. Yes, I'm a proud sponsor of Helping Seniors of Brevard, and it's a wonderful group of people, and I'm very proud to see how much it's grown.
Yeah. You know, Joe always talked about his vision for the center, by the way, was he wanted to get all these resources in one place. So when Nancy takes a call, or one of our great volunteers pick up the phone, last year we took 4,500 plus calls on that senior information helpline. I'm going to read that number out. So grab something you can jot it down with. It's a great number to have handy. 321-473-7770. I'm going to say it again, 321-473-7770. But as she takes those calls coming in, Joe's vision was that we should know somebody that's going to help advance that. People say, what do you guys do? We call it senior navigation. What we're trying to do is, when we meet a family or a person that's running into these challenges, we can't solve everything, but we're going to try our very best to make sure we get them pointed in the right direction, or as I like to say, we're going to try to navigate them to a safe harbor for whatever storm that they're facing. And we get calls about everything: housing, legal, medical, financial, transportation. And one of the things that Joe wanted us to do was build a community that was really caring for seniors. And one of the things, Denise, that we have really been blessed with is finding great people like you who, while this is a business, this is also so much of who you are, and you're just always diligent about making sure that you find a fit for the family, even if it's not something you yourself can provide right at the moment.
Well, thank you so much for the compliment. I appreciate that. But it's something that I find that I need to do. If I have a family that comes to me and they have a concern, if it's something that I can't provide, I always let them know that I am a proud sponsor of Helping Seniors of Brevard. And the reason being is because I know these folks are vetted and that they can help. And I want to be able to give my families trusted resources.
Yes.
So, if they're not quite ready for my services, I have a discovery call with them and I'll say, well, what are your needs? Because I could likely direct you to somebody in our community of people that can help you.
I think that's one of the things that you're saying is so important that people understand, because Joe called it making an aging plan. So we get a hurricane plan. It means we want to know what we're going to do. It doesn't mean we want a storm. And then to make it feel a little bit less maybe intimidating, we just kind of call it helping you get your ducks in a row. But as part of that, we've actually come up with like kind of a 7-pillar program of areas that we want you to think about as you are making an aging plan and getting your ducks in a row. But there's 2 very important things that we talk about a lot, Denise, and I think that's what we're going to get into today as we really get into the meat of the show. So one of the things is we say, please don't try this on your own. A lot of times people think they're masters of the internet and they're going to, especially with AI, now we think we're really sharp, right? Mm-hmm. And we're just going to go ask the computer a question about where does grandma need to live, or where does mom need to live? And we're going to take that as gospel truth. And they have a term in AI, Denise, they call it AI because it's just they call them large language models. So they're just whatever is in their data. Remember, garbage in, garbage out. So they call them hallucinations. Like, we're going to talk about that a lot when we talk about the scam jam coming up. But they talk about how AI can have hallucinations, like it will give you something that doesn't really make gibberish. And usually, even if you're using one of them, one of the little disclaimers down at the bottom of your screen is don't necessarily take this as gospel truth, because we don't know. And so a lot of times people think they're being clever, and they'll try to research places to live or things like that, or just whatever they're trying to solve. And I don't know, but a lot of times you can find stuff that isn't relevant for our area. You might be searching stuff for, I don't know, Idaho or Montana. It doesn't have much to do with Florida. Or you might be finding stuff that was relevant 10 years ago because it was published in 2014 or something, and it you don't know if it's accurate. So, or if that place is still in business or whatever the case is. And so we say, please don't try this on your own. And that's one of the reasons why you're such a trusted person in the Helping Seniors family, is because we've seen you time and again. We called you not long ago with a particularly complicated situation where we were trying to help a family. The lady was trying to help her father, and it was very confusing and very complicated. And even though Nancy and I had exhausted a lot of things, we thought we need to call Denise on this and see if you can bring, and you brought some brilliant ideas, but that's the point. That's your experience speaking.
Thank you. I appreciate that. And it's interesting, the story you brought up about AI, because it is the buzzword, but it's everybody's, trying it, right? Yeah. So I had a gentleman call me not too long ago, and I explained to him how my placement service works and my advising services. And I shared with him that if he's already reached out online and registered with, for example, a Place for Mom, or with any community, even if he just put his email in, that he is now registered with that community, and that community will not work with me as an advisor because now he's registered with them. And he was so frustrated. He says, why did I do that? Why? And I said, it's okay. You didn't know. You did what you thought you were supposed to do. And I said, I'm still going to offer you resources. I'm still going to take my time to help you because that is the right thing to do. But if there are any communities that you have not contacted yet, those communities will work with me as an advisor and a liaison to assist you. But a lot of people don't know. They see the commercials on TV. And again, like you said, they do not have boots on the ground here. And communities do change policies. Sometimes ACA comes out with new rules and new regulations and new statutes for the state of Florida that are not quite yet updated in or on the website. And as I learn, I share with my clients. But you're so right. It is so much better to work with somebody that's local, because I'm working with these communities often and I know about the changes, and I'm happy to work with those families. But the moment they are registered through a Place for Mom online or one of those commercials, they can't use a local person, because that's how we get paid. Or we get paid not by the family, but once and if we do make a placement through the community.
Yeah.
So, it makes it confusing when you go on AI.
You're such a great resource, and you're a no cost to the family resource. And I got, because I was just going to bring that point up too. Whenever we have the opportunity to talk about how to do your aging plan the right way, we always tell people, like, it's fine if you're looking for some general information and you're just going to search and see if you can become a little bit more knowledgeable about a topic. That's probably a worthy thing to do, but be careful when you start dropping your name in and email address and things like that. And then the other thing that we often counsel people, said, please be careful with 800 numbers. We had one of the last times you and I were on the radio together, we had Mindy Nadeau from Walked In Alzheimer's, and she goes, well, I'm sorry to tell you this, we have an 800 number. I said, no, your 800 number is perfect, because you are there as a resource to help families that have just discovered they're on a memory journey. What we're talking about is people who see their favorite TV star talking about Medicare. And so call this 800 number and we'll get you set up. And you're not going to talk to your favorite TV star. You're going to talk to somebody in a call center in Iowa, and they're going to do the same thing you would do. They're going to sit on their computer and try to figure out something from the Midwest that's going to benefit you here in Florida. And the question is, why wouldn't you just call somebody local? And in your particular line of work, it's even more important to call you first, because I had a question when you were talking about that. So, like, the person that you spoke with, can they revoke their name from the list? Like, hey, because I put my name, because it's not clear when you do those little sign-up forms. You think, oh, I'm just going to get some more information. You didn't realize that now they claimed you, and an advisor can't help you with that location.
Through my experience, they can certainly try, but it typically doesn't work, because what'll happen is that company then blasts an email blast out to all of the communities in this county, and those communities have contracts with those 1-800 numbers, and so therefore they have to continue to work with them. So again, I do the best I can to explain, and I share as much local resources that I can. One in particular, and the reason why I'm thinking of this is I was looking at your wonderful LinkedIn that you share out with Helping Seniors at Brevard, with the wonderful resources and presentations that you do. And Jillian Zebris, owner of Chefs for Seniors, I refer her out often, because people will call me. Sometimes they don't need my assistance for another year, but I'll tell them, how does your loved one eat? Oh, they just eat microwave food. I hear that a lot, because that's all they can do. And I share that. That's a wonderful resource, Jillian. And a lot of folks, wow, I didn't even know that was something I could do. So, I'm happy to share those resources to get people in the right direction. Yeah.
We're talking with Denise Bergman with Senior Care Authority of Brevard County. And what I love about it is that you are 100% local, but you're also connected to a huge network. So unlike when you call that 800 number for a Place for Mom or Dad or whatever they call themselves, you're talking to somebody who's local, but then because you are connected in this national network, let's say somebody is moving from, upstate New York, and they're coming to Florida, you are really set where you can help both sides of the equation, because you will have cohorts who are doing the same thing locally on the ground wherever that person is.
Good point. And I'm actually working with somebody now who's, interestingly enough, he called me a few months ago, moving mom down from New Jersey, have to sell her house. Everything was fine. We were looking for independent living. Sure enough, last week I get that phone call. There was a fall. Now it's urgent. Lord, So here we are now. So instead of looking for independent living, now we're having to look for assisted and therapies. So things change quick. And so, now I'm working with him so that we could get him in the right direction, starting with safety. We're not talking about independence anymore. So, it's so important to, when you know that there might be, you might need to look for something in the future. Start early and, get on that path.
Thank you for saying that, because that's actually the second. We talk about these 7 pillars of an aging plan. We say there's 2 corollaries. One is don't try this on your own. Get a hold of somebody who's local. Like what I always explain to people about what's so great about you is you go to all these locations. So if you're talking to a family and say, I understand what we're looking for mom, and this place might be a fit, but you're not just reading it out of a catalog. You have been there. You know what the food is like. You know what the caliber of the help is. So you have this whole idea. And something you told me one of the first times we were on the radio together that's always stuck with me, you said your goal is to make the right move so we don't have to do this again.
Oh, yes. Moving is very stressful for folks of any age, but then you add in the fact that now we have a senior who may have some physical impairments, some medical impairments. So we really want to do this once and do it right, so that we don't have to put all of that extra stress on the family members. And of course, making sure that the caregiver is taken care of. I want to make sure that they are taking care of themselves. I'll always ask them, and how are you doing?
Right.
Are you taking care of yourself? Let me know when the right time is that we can maybe get you involved in a support group, and I'll help you find that. Another thing I also like to do for my caregivers, speaking of caregivers, if I know that I placed a loved one in that community, I'll put them together and do like a matchmaking.
Yes.
Caregiver to caregiver. And I'll say, hey, look, you both have loved ones here. I'd like to introduce you. And I've done that a number of times, and it works out really well.
That's good. Well, so that's, like I said, that's corollary number 1 is like, let's call somebody local. But the second thing that I often really talk about, and I think this goes to the heart of what Joe wanted us to do with that aging plan. We say it's like, don't be an ostrich, don't stick your head in the sand, because the sooner you can plan these things, you have more options. I was thinking about specifically the story that you just relayed. As stuff happens, which is often happens, things can shift pretty dramatically and pretty suddenly. And so all of a sudden, when you're trying to make a decision under crisis, you've got a lot more stress. Usually your options are more limited than they were before this crisis happened, and therefore it's going to cost more. So, there's so much benefit to calling Denise Bergman, Senior Care Authority, early on, and even if you're just exploring. Am I saying that right?
Absolutely. And a lot of times, and I understand this, a lot of times people think, well, there's got to be strings attached. I don't have time to make another phone call. And I get that, because before I started this business and I was researching the different things that senior living advisors do, I thought, you know what? That person is going to really have to trust me to pick up the phone and call me. They don't know me personally. They're going to have to trust that I am going to stand by them. Yeah. And so I really try when I work with my families to say, hey, you know what? I know somebody that's just been through this. Would you be interested in meeting them? We've met all for coffee, and I'll introduce them so that I can create their own little support group, because I think support is very, very important. AI is great, but they can't be that. They could pretend the robot can come on and answer all your questions, and you feel like you're having a back and forth. But for somebody to truly hold space for you when you're going through something so emotional, I try to be that person as well. Yeah,
people are necessary. It's so necessary, and isolation is such a problem for our seniors. So I wanted to, we actually have kind of a program we want to get into, because you prepared some stuff. Father's Day is coming up, and you have some great information to share, which we'll probably use mostly in the second half of the show. So I want to make sure you stay with us on that. But I just want to say right now, one of the things that Joe was so adamant about was that we build a network of people who put the seniors' needs first. Yes, it's their business. They have bills to pay too. So it's a business, but there is businesses that are there to serve the customers. And that's what Joe always wanted to assemble, was groups of people who are serious about what they do. So when we talk about it in our Helping Seniors world, like if somebody calls us with Medicare or Medicaid kind of questions, there's a couple of people that we are real quick to refer out to. Interestingly enough, we as a nonprofit don't necessarily say, well, this is the one person, because we want, if we know of multiple credible people, we want you to know who they are, and then let you figure out who fits you better. but they all are local people who are very good. And as I often say, when we have like a Golden Providers meeting, which is a group of businesses that come together and we all try to get better at senior services, we also talk about the fact, there's 650,000 people in Brevard County. 25% of those are over the age of 65, and 1 out of 2 of those is over the age of 50. So ARP is going to slap the senior label on you at that point, whether you like it or not. Mm-hmm. And so there's plenty of business out there for businesses who are really looking after it. And that's why that whole thing, it takes a village, is so important. Denise, and what you do, just like when we talk about Vicki Moore or Jerry Hadlock, who are great resources on insurance kind of stuff, or if we're talking about people who are trying to look for legal help for elder law, we have at least 4 wonderful elder law attorneys that we have no problems to recommend out. And we say, you should talk to these guys. Mm-hmm. Maybe somebody's geographically closer. Maybe somebody speaks to you in a language that just is easier for you to grasp, and it just feels right to talk. But we know these people are all very competent. So when it comes to senior care and placement and thinking about living options, this is one of the reasons why we can say, let's call Denise Bergman, because she's going to know what to do. You're actually a CSA, which is a certified senior advisor, which means you actually went and took additional coursework to make sure you knew everything you could, or be the best you could, right?
Yes, I appreciate that. Yes, with our franchise Senior Care Authority, they have all of their senior living advisors take this course, and it's great because you learn the foundations of all of the different avenues that seniors need to look at or navigate at some point. And again, oftentimes it's not something, they want to talk about, but we do have to have a plan. And I find that when you have a plan, you can be a little bit more relaxed. Yeah. And I can speak from experience with my own parents. They certainly didn't want to speak about it. Yep. They raised 4 children. They always had a very busy life, and everything was, moving along very smoothly until, the memory issues started, and things changed, and they changed quick, and we had to sit down and have that family talk. And so it's very important to have a plan in place, like we say, and, the more we talk about it and the more we normalize it, better off, because we have great resources here in Brevard. Yeah,
I always said that. Joe always said there needs to be more resources for seniors, and I totally agree with him. But I often would argue back to him and say, Joe, is it that the resources don't exist, or is it that people don't know where to access them? And I said, if they don't know where to access them, the greatest resource could be there, but it's not going to help somebody. It's like the tree falling in the woods kind of thing. If you don't know it's there, it's not going to be able to help you. So I love what you're doing with that. Let's talk about, you also do a great newsletter. I get to read it every month when you send it out. I want to talk about, if somebody wants to get in touch with you, Denise Bergman, Senior Care Authority, how do people get in contact or start a process, just to have a conversation?
Well, they're welcome to call me at 321-549-9045. That's 321-549-9045. And then, of course, I have a website, Senior Care Authority of Brevard. We are a national chain, so there's senior care authorities throughout the U.S. I have a local website, which actually was just updated and has some really great information for caregivers, typical questions that people ask. And also, too, there's some fantastic live podcasts.
It's good. Well, we're going to come back on the second half of the show and talk more with Denise Bergman about 10 signs your aging parent may need additional support. Stick with us for the second half of Helping Seniors Radio right here, 90.3 FM, WEJF.
It's 12:33 right now here on 90.3 FM. You're listening to Helping Seniors of Brevard. I'm John Harper. Kerry Fink is your host. Kerry, that music is rather appropriate, I think, right now, in the fact that has been the theme music for our program of the Information Overload Hour for the past several years. And I'm sad to report that my co-host, colleague, and good friend Jim Votro passed away over the weekend, and he certainly is going to be sadly missed.
Yeah, nobody will be able to fill his shoes. He was such a friend. You know, we were talking in the first half of the show, John, about how important it is and how I really feel privileged as kind of the newcomer in the helping seniors world. You know, it says a lot when people have been willing to devote, you know, everybody can get excited about something for a minute, but when they are willing to devote years to helping stuff happen, that really says a lot about them. That was always the way I looked at Jim, because there wasn't a time I would come into the radio studio and see Jim and he wasn't like, this is so important. We gotta keep you. We gotta find another way to do this. And one of the most recent things that he was on, and he was so right about this. You know, he was doing all the research about tiny houses because we have such a problem with getting people to find affordable living. And he was really, I think, really onto something, because he was finding all these like where they were like pop-up houses, for lack of a better way to put it, very affordable. And so he always had an initiative that was going to be good for seniors. And what a loss that is for us, because we don't have the benefit of his wisdom. I mean, I think he was getting ready to turn 80 in a matter of short little bit. And, you know, he served our country. He was a hero in Vietnam, a helicopter. I remember we had Dwight Bell with Wings of Grace, and the two of them got into helicopter shop talk. It was so fun to listen, because they both knew exactly what they were talking about. And Jim was just the kind of soul who would always have a smile and be happy to welcome you to the studio, and was just 100% about all things helping seniors. I don't know what else good I could say, but there's not enough to say.
there are so many things, Kerry. He had such a brilliant mind. He had been a broadcaster for over 50 years in radio and television. He had a sterling success as a vice president, general manager at KCBS Television in Los Angeles.
Yes.
That was a big deal.
Yes.
And he was there almost 10 years, and he was very proud of that. He had a lot of initiatives that he started out there. He was the first to have news bureaus in 10 different locations throughout California.
Wow.
And I used to joke with him. I said, what would you do in visiting those bureaus? And he said, well, I'd get the KCBS helicopter, have them fly me unannounced, fly me unannounced to the bureau, and pay a surprise visit. But he was very proud of that, very proud of his radio station in Virginia.
Yep.
And he also ran a TV station in Washington, D.C.
Yeah.
Real quick, and I'll let you get back to Denise here, but he was the only TV station to be able to provide footage, and I'm sure you'll remember to this moment, you remember when the Air Florida plane crashed.
Oh, yes.
And the footage that was shown was from his TV station.
Wow.
And from a person that he had assigned to go out and cover that. And he was very proud of that, coming out of that tragedy, of course. But he did so many things in his career.
Yes.
And as you said, Kerry, very proud of this organization, and really wanted to help as much as he can.
Absolutely.
And we'll continue to do so.
He's always such a blessing. You know, I was thinking about that. People don't realize when they met Jim, or for that matter, when they meet you, they don't understand the height of the careers that you guys were both kind of like top of your game. You were like top in Miami, Detroit, all these different things. And we're fortunate. I always would say that we're so fortunate that people decide to come down and make Brevard County their home, because we wind up with some incredible people with some incredible talent here.
And I feel the same way, John, and my condolences. And I have to say, I had the good fortune to meet Jim a handful of times, and I think it's beautiful that we're celebrating his memory right now. And every time I met him, he would be serious for a few minutes and always found a way to get a joke in there, which I always love and appreciate because I think laughter is the best medicine.
It sure
And
is.
so my condolences.
Well, thank you.
Yeah.
Thank you. And we will continue to carry on, certainly with our show here on Wednesdays and with the Information Overload Hour on Mondays and Fridays, and who knows, maybe even expanding. So we'll talk about that later as things move on. But right now, let's move on to the rest of your show, Kerry Fink, with your guest, Denise.
Yeah, thank you, John. Yeah, for sure. You know, it's kind of like if Jim was sitting in the studio, he would be like, "Now you guys got to keep this going." He was like, he had the same enthusiasm and passion that we all do. Because like there's Joe sitting in a hospice bed, and he wasn't worried about himself. He was like, Kerry, you and Nancy, you guys have all got to work. You've got to keep this thing going. Seniors need you more than ever. Wow. And I think that is a legacy that we need to keep in mind for Joe, but also for Jim, because, you know, it's easy when you have a job and you're in your 30s or 40s, you're making a living. But when you're 80, almost 80, you don't, or Joe, who was over 90, he's like, you don't need to do this. This is something you do because you care and you want to give back into the community. And so that's one of the reasons why I think folks like Jim Votro are just so inspirational. And Joe, to this day, we talk about him all the time because we're always like, what would Joe say to do about this? And it really is kind of a guiding force for us. But we'll miss him, no doubt about that. So, but back to what we do want to talk about today, because we came out of Denise came well prepared, and she brought us a thing that's now out on her website because we're just about in time for Father's Day, and this is 10 signs that your aging parent may need additional support. And I think this is such an important conversation because one of the big challenges, Denise, that I think we run into is we were used to being raised by our parents. They were the authority figures. They told you what time you had to be in. Did you get your homework done? What time when you could go out, what time you had to be at. All these things. What are you going to do with your life? How are you going to, all these things, they were the authority in your life. And then as you get older, it shifts a little bit and you're a little bit more on equal terms. You can have conversations. Well, I'm going to do this. And, even if you disagree, I'm still going to do this. And you guys can work all that stuff out. But there comes a point where it reverses. And sometimes the child has to kind of start managing the process for the parent. It's a very weird in your head kind of shift. And I thought what you put together here is such a good kind of like primer on it. So let's see if we can kind of dive into these 10 things. So if you've got a notepad, jot a couple of things down here. Before we jump into this, again, I want you to remember the name Denise Bergman, Senior Care Authority. And Denise, let's make sure people know the phone number and the website in case they missed some of this and they want to come back and get it.
Great. Thank you so much. So the website is Senior Care Authority of Brevard, and my business number is 321-549-9045.
All right. And with that, let's dive into these 10 things because, it is a challenge because, these things don't usually start with a sudden event. It's sort of like, I've heard from everybody. I've talked to like Jennifer Barton with Seniors Helping Seniors, and she talks about particularly the first rung. A lot of times, especially around the holidays, she'll get a call from somebody and they're like, we were down visiting mom and dad and they told us everything was fine and we were there visiting and I don't know about that. Mm-hmm. So let's jump into this list.
Yeah, absolutely. And again, I dealt with this not too long ago with my own parents.
Sure.
And, as an adult child, you start noticing things with your parents, it usually goes on. And then if you have siblings, you'll talk to them. Hey, did you notice this? And are you noticing this too? And so when you start seeing that and you don't quite have a name to it, that's when you want to start, organizing and getting a plan. And oftentimes one of the first things that we'll see is changes in memory or confusion. And it's just one of those things you just want to start to monitor or keep a mental note or start making a journal. And, it could be regular, just typical aging, or it could be something else. So these are things we really want to look at. And if you have examples, start really being mindful of that. And is it something that you may need to discuss with their primary care doctor?
Yeah. Yeah. Well, I think that is so important. And, it's so funny. We were just having, as I left the center up there, Dr. Mike Edwards with the Faith College of Natural Health was doing a presentation for everybody that was there called Your Memory and How to Keep It. And there are a lot of things that you can take steps that will make a big difference in your memory. But one of the signs that we're looking for is when the confusion starts to move beyond where did I leave my car keys, I think.
Yes. And it's also, too, we spoke about earlier, the 1-800 number for the Alzheimer's Association, and their website is just full of fantastic information on memory screenings and where you can find those in your neighborhood, just to have a baseline. Even if you don't have actual concerns, you want to have a baseline for brain health, just general brain health. And that was sort of how I started that conversation with my parents in a very non-threatening manner.
Right.
So that's another little tip. And of course, another thing that you want to sort of look at when you're visiting with your parents, do they have difficulty managing their daily tasks? Or another word for that would be activities of daily living, or you may have heard folks in the healthcare field refer to them as ADLs. Just being mindful of that, because of course they're going to tell you everything's okay, but you just want to take a peek at that.
Yeah, ADLs, by the way, we live in Space Coast, so we're used to what do you call them? Acronyms like NASA, National, but ADLs is activities of daily living, and those are the ones that everybody kind of like keeps charge of it. There are things like bathing and feeding yourself and those kind of dressing and things like that. So that's the second one. How are they doing with that? What's the third one?
Yeah, the third one is there noticeable weight loss or poor nutrition? And we know oftentimes, folks will just throw something in the microwave. Well, that's not the most healthy choice. There's a lot of preservatives, a lot of salt in those types of microwave meals. And there are other options. There are healthy options. Right here in Brevard, we have Jillian Zebras, owner of Chefs for Seniors. You check out her website for sure. She goes right to the senior's house or one of her chefs and cooks for them right in their own kitchen, and the senior can be there having a conversation about food. And it's just a great social interaction, and we're working on nutrition, keeping them healthy.
Yeah, she is such a great resource on so many things. She does a program for us at the center called Nourish Your Spirit, and together with Senior Helpers of Melbourne, it's a cooking/tasting class. We just had one, I think it was last week, and she was doing non-dairy, and she gave us macaroni and cheese. Okay, but it wasn't cheese. And I told her afterwards, if you had not told me that this was non-dairy, I would not have known. It was incredible what she was able to do. So there are ways to do what the doctor is telling you about. Although I smile because, I remember in my own mother's case, she was literally right next door to us. So we would try to stock her refrigerator with good things, and she would come over to our house and have dinner. So we knew she was getting a good dinner. But during the day, we would try to stock her house with all things that we thought were healthy, doctor approved. Right. And we'd get over there. What did you have for lunch? Oh, I took a piece of bread and threw a slice of cheese on it. And that was all. That was the only thing. And so we're like, okay, but you're not really. That's probably not the best for you, right?
Right.
So that's part of it, too. What's another one on our list?
Absolutely. So another one would be, take a peek at your parents' mobility and their balance issues. Boy, that is so very telling, especially when you see them just transitioning from chair, to get up to start walking or vice versa. And, how steady are they? I had issues with my own mother with this because she unfortunately was having reactions to her medication, and she didn't even really notice it. And she was she could not walk a straight line. And she was walking tilted. I'm like, Mom, do you even realize what's happening here? So, I had to get her on the road to PT and OT, and all of those things are, very, very helpful. We want to prevent falls, and that's the whole idea there.
There is so much to do and all that. I was thinking about one of the folks that we work with, Peter Rentz and Physical, F-Y-Z-I-C-A-L, Therapy and Balance Center. They have a couple of locations beachside, and he's been kind enough to take time to come over and talk to us about falls and prevention. And we learned so much because I think what happens is because these kind of things that you're alluding to, they kind of sneak up step by step. It's not all of a sudden like, now if you're the person who lives up north and you come down and visit mom and dad, it might be, I didn't see him in 6 months. Wow, it's really changed. But for a lot of us, it's just like, it's like little incremental things that we're trying to watch out for, right?
Little things. And as a matter of fact, one of my visits with my own mother, I noticed as she was walking in her living room, she kept holding on to the furniture. She didn't even realize she was doing it.
Right.
And I said, oh my gosh, I'm like, Mom, are you okay? Oh yeah, I'm fine. Why? Like, Mom, you're holding on to for everything that you pass by to keep you steady. So these are things we want to look at, because there's, therapists out there, PTs and OTs that have, fantastic care plans that they can, get seniors on, even if they go, once or twice a week in the beginning, and then you could do maintenance plans.
Yeah, absolutely. Absolutely. All right. Well, give us another one.
Yeah. Another thing we'd like to encourage our adult children to look at are changes in personal hygiene. You'll notice that oftentimes if memory is impaired, they may not even remember that they didn't take a shower.
Yeah.
So that's very, very important. We need to look at that. Medication management is huge.
Oh my goodness. Yes.
That is something as an adult child you want to take a look at. Make sure that they have sort of a routine in place with their meds. Do they have a pill box? After they take their pill, do they flip the bottle over so that they knew that they took it? Because oftentimes they'll say, gosh, I don't remember if I took that or not. It happens to me. So I had to come up with my own little method of remembering what I took.
Yeah, I used to fuss with my mom because of the same thing. The doctor had a certain number of prescriptions, and these in the morning and these in the evening. And so we came up with a little pill box idea and tried to let her manage as much as she wanted to with that. And a lot of times she would tell us that, oh, I've already had my pills for today. And I'm like, Mom, hold up that pill box. They're like, it looks like this is still full.
Yes.
Oh, but I think I took them this morning. And I used to kind of like, I don't want to say fuss, but I used to like, Mom. And then it happened to me because I don't take many prescriptions, but I think I had like a antibiotic for something. And I would go back to Tammy, my wife, and go, did I take this already? And I'm like, okay, I'm just trying to parse out one pill. I can only imagine what it is like for the senior with a whole set of prescriptions they got to work with.
Correct. And with that also, there's a pharmacy here in town called Aquaviva Pharmacy, and they do where they package the pills for you. It actually has the time on it, and it comes complete in a box, so you can't mess up.
That's good.
You just can't. So there certainly are ways other than your traditional pill box. Another thing I like for my adult children to look at is, do you notice increased isolation with your parent? And that could happen for a number of reasons. They could be having difficulty initiating conversations. So maybe they're no longer getting involved in their social group or in their religious groups because they know something's wrong, but they can't quite put their finger on it.
Right.
And so we need to look out for that as well.
Good. No, that's an important one too, because interestingly enough, we're in the middle of a thing called the Brevard County Senior Needs Survey that we're doing through the Brevard Commission on Aging. And this is actually a county-wide survey. And between now and the end of October, everybody would come in contact. We're going to talk to them about, have you filled out this survey? Because our goal is to get like several thousand responses and present this to the Brevard County commissioners and kind of like, this is what seniors are self-reporting as their top needs. But when Joe and I and John all did this through Helping Seniors, we did this like back in 2015. Joe, when he looked at the results, he goes, Kerry, these are the same results I saw in 1995 when we did this through Brevard Alzheimer's. The needs for seniors are pretty much still the same. But my point is, isolation was really a top concern. I mean, I understood medical and financial and those kind of questions, but I was really surprised as the first time I haven't gone through that, how important that question. So if people are becoming isolated and then disconnecting, that could be a trouble sign.
Absolutely. Absolutely. And I'm happy to hear that survey's out there.
Yes.
Fantastic.
We'll talk more about that, of course.
I'd like to. And another point I would like for my adult children to look at are home safety concerns. Are there trip hazards?
Yes.
Are you noticing spoiled food left in the refrigerator? Just these are types of things that, you can have a chat with your parents about, and just make sure that they're looking out for these things. Safety bars and showers and bathrooms. That is huge.
Yeah.
Another thing I always say, just monitor changes in mood or behavior. In seniors, UTIs are just so prevalent, and a UTI can make a person confused or change their mood and behavior, and something as simple as an antibiotic can fix.
Yeah. This morning, and now on every third Wednesday of the month, we're doing a thing called Coffee with a Cop, or specifically call it Java with Joe, because we're visiting with Joe Downs with the Brevard County Sheriff's Office. So he works with Sheriff Ivy, and he's their key go-to guy about senior things. But it's called Java with Joe. It happens every third Wednesday. We just had our inaugural session. We had coffee and donuts. What else do you do with a cop? Although Joe was saying next time could we do steak and eggs? I said, well, we'll have to talk about it. Rhodes Law is helping us put all that together, and so we said, well, maybe we'll have some kind of a festivity 6 months out, and we'll see what we can come up with. But for now, it's a great conversation. We have wonderful coffee and donuts with our friends at Dunkin', and it's a good thing. But the point is, he was telling a story where he got called out, and it was actually a lady with a UTI that they kept Baker acting. Baker acting, if you don't know, that's where the police come out and say, oh, you're sort of basically, to dumb it down, you're not in your right mind, so we're going to send you for observation for a few days. And she'd been Baker acted like 22 times is what he was saying.
Gosh.
And nobody had thought to do the UTI check. And once they got that under control, she's right back where she's supposed to be and has been good ever since.
Yeah.
So to your point,
Very, very important. Whenever I have a family member that calls us, one of the first thing I ask, did you rule that out?
Yeah.
Have you ruled it out? Because I can't tell you how many times they've gone to the doctor and the doctor has tested, and sure enough, so here we are. But now you still have to deal with that confusion, and we have to make sure that the senior is safe during the point where they're taking the medication and trying to heal.
Correct.
So, and then another big thing that we'd like to look at is, we have to look at the caregivers. I mentioned that in the earlier part of the show. We have to mention the caregivers, because if they're not taking care of themselves, they certainly can't care for their loved one. So we need to make sure that if our mom or dad happens to be one of the caregivers for our other parent, we need to make sure we check in on them, make sure that they're taking care of themselves. And if they need to get out and have a breather, that we get respite care for the the other half of the couple.
Yeah. Well, that's what we're talking about. It's a date to jot down on your calendar. You're going to hear more about it in the next week or two. But we are doing a caregivers conference right there at the Senior Resource Center. It is going to be on Thursday, July 16th, if I said the right date. That's going to be right there. And you have to RSVP. Lunch is included, which is why you have to RSVP, because we can't have more folks than we have space for. So it's free. And we're putting it together with our friends at ARP, but that's an important date to put down on your calendar. Another important date, Denise said I wanted to make sure we mention before we run out of time on the show, is last Saturday of this month, which will be June 27th, we're doing an open house at the Senior Resource Center. It's called Cars, Cuisine, and Community. And our friend Bill Antonetz, who does all the great car shows, we're in a doctor's office building, but on Saturday, nobody's having appointments. So we get to take over the parking lot. He gets all his car friends out there with these great cars. And inside, we're going to do an open house so you can see where we answer the phones. You can see our podcast studio. You can meet a lot of the people in the center. A lot of our great resources are going to be there. And then Chef Jillian, who we were speaking about, is inviting 12 of her restaurant friends to bring us some great, great taste. That's the fundraising part. They're all donating the food, but you donate for a little taste ticket, and then you can go sample stuff from Yellow Dog Cafe, Jersey Brothers Diner. There's going to be like a dozen different places, Chef Kamal's Kitchen. There's so many good tastes out there. And that's a fundraiser for helping seniors to help us keep our little nonprofit rolling along. That's Saturday, 10 to 2 on the 27th. So I think, Denise, that's more or less the time we have for the show. I want to make sure before we close that we get your name, your company, your phone number, and contact information in case people want to follow up on some of what we talked about today.
Well, thank you, Kerry. So my full name, Denise Bergman, owner of Senior Care Authority of Brevard. And my phone number is 321-549-9800. 9045.
Yeah, and if you ever miss a number or anything, that's why I always encourage people to put our number down, because you might have heard that. So I really liked what Denise was talking about, but I was in my car. I didn't get to write this down. So if you keep the Helping Seniors number handy, it's great for any of these. Oh, I heard you guys talking about the Cars and Cuisine. When was that again? Just call us, 321-473-7770. 321-473-7770. We're here to serve you. That's about the time we have for the Helping Seniors radio show this week. We sure look forward to being back with you on next Wednesday right here, 90.3 FM, WEJF. Have a great week until then.